Okay, we are now live. I'll wait for a few attendees to show up before I introduce you. So this gives you a little bit of time, Jamie, to set up the presentation. Awesome, we already have a person over. Great.
Well, this is definitely a topic that needs to be discussed, especially on Staten Island.
Definitely.
Yeah,
I couldn't agree with you more.
Yeah,
I mean,
it's
it's
actually our overdose rates have kind of went up a little bit since everything has been going on,
Since
which is
COVID? Oh yeah, absolutely.
so is mental health, I'm sure too.
Yeah.
So let's just start then, and then we can continue as people come in. So Jamie Longo, thank you so much for joining us. This is Anissa Bakeshi from the SIEDC, and we also have Jacqueline Diaz from the SIEDC. Thank you so much, everyone, for joining. This is Jamie Longo from CHATSI, aka the Community Health Action of Staten Island. Jamie, take it away. Thank you.
Thank you. Hi, everybody. Again, my name is Jamie Longo. I work as the overdose prevention coordinator at Community Health Action, and I work within the harm reduction department. Today, we're going to be going over Narcan. I'm just going to share my screen really quickly. Make sure I'm sharing the right one. Hold on, I didn't share the. Oh, yeah, I did. Right? You see it?
Yep, that's the right one. Yeah, we're good.
Okay, perfect. All right. Put this up. All right. So I'm going to go through, first I'm going to go through a few statistics, and then we're going to go into the training, exactly what to do if you think someone's overdosing, how to recognize an overdose, as well as how to use the medication and all the specifics surrounding it. So we'll begin. So unfortunately, the CDC is very backed up with data. So the newest data that we do have is 2018, but this is going to be relevant to today because it still hasn't gotten much better from what we've seen since then. So on average, there were nearly 4 drug overdose deaths every day in New York City, and 1 overdose death every 6 hours, and that's just New York City alone. So every 6 hours, by the time you started your day, by the time you ended it, somebody had lost their life due to a drug overdose. More New Yorkers die of drug overdoses than homicides, suicides, and motor vehicle crashes combined. That's not just in each category, but if you combine those numbers together, that it still doesn't beat drug overdoses. So nearly 450 people died from overdoses involving opioids, including prescription and illicit opioids from 1999 to 2018. So that is just strictly the opioid class, and that is what Narcan is actually geared for. So we're going to go into that a little bit later. But lastly, I want to just touch on is that nearly all, which is 97% out of the 100, unintentional drug overdoses involved more than one substance. So even if you think someone is strictly using one thing alone, there's a very good chance that you don't know that they're combining drugs or they're using something else other than what they're telling you that they're using. Sometimes they don't even know that that drug is mixed into their supply. So it is important just to kind of keep that in the back of your head, because when you come to somebody and you think that they're strictly a cocaine user, which Narcan is most used for opioid overdoses, it's an opioid overdose reversal medication. So if cocaine and opioids are completely different drug classes. If you think that they're strictly a cocaine user and you don't give them the Narcan, you kind of are eliminating the fact that fentanyl could be mixed into their cocaine, which we've seen in the past 3 years. It doubled our cocaine overdoses due to the fact that people have been mixing fentanyl into cocaine. So it's always safe to say that you can always use the Narcan. I'm going to go around over the specifics around why that's okay, but I just want to make sure you keep that in the back of your head, is that even if you think you know what someone's using, there's a very good chance you don't know the whole story. There's a very good chance they don't know the whole story either. Now, in Staten Island specifically, I'm not entirely sure why they break it down this way, but they break down Staten Island this way, just giving you kind of an overview. And when it comes to statistics, I would say that, yes, some areas did get hit harder than others, but across the board, I would say that we've all lost a significant amount of people due to overdoses at one point or another. The highest ones were North Shore and South Shore, but that doesn't exclude Mid-Island because they shot up a little bit later than the other two, but they did shoot up to the same amount of numbers that we've seen across the island. Now, this was predicted in 2018, but this was kind of, so like I said, we don't have up-to-date I guess, like concrete evidence of exactly what we would need in order to make a chart like this. So this was like kind of like a provision or a prediction of what they believed that the numbers would be by the time it hit July 2019. So as you can see, the reported value and the predicted value, which reported, like I said, it's based upon what is already reported. We don't get those numbers until 2 years after it's actually been reported, because things will start to trickle in and things along that nature. So predicted value and reported value are right along the same exact line. And it all has consistently either gone up or just completely plateaued and stayed the same. So nothing has gone down in relevance to drug overdose deaths. So there, I mean, you may hear a few people say the word opioids or opiates. So they're pretty much the same exact thing, except one is a derivative from the actual opiate, the poppy plant. The other one is synthetically made. So as you can see here, the difference is opiates is the ones that come from poppy. That's also the type of drug you'll find in morphine and heroin. Opioids is the manufacturer, so it's like the synthetic version made in labs, and that's where your prescription pain medications usually come in. So your Vicodin, Oxycontin, Percocet, Percodans, Dilaudid, all those medications, those are all opioids, and you know the more natural stuff is an opiate. So as I just kind of listed off a few of these, just so you guys know, this is primarily exactly this is the most commonly seen drugs that you'll see that fall underneath the opioid class. I can also give you a link to my my YouTube page. Since the pandemic started, I started a YouTube page which has all my presentations on it, or almost all. And one of them is the drug classes and the drugs within them. And it kind of walks you through each drug class and what drug you would find underneath it, as well as the street name for each of those drugs as well. So that you can become more familiarized with, you know, whatever particular situation where you may need to know those type of things. Okay, so fentanyl. We're going to very quickly jump into fentanyl, and that's just because fentanyl has been the kind of the big bad wolf that has come into town these past 2 to 3 years that we've had an increase in overdoses. So fentanyl is 50 times more potent than morphine, and it's actually it's 50 times more potent than heroin, and it's 100 times more than morphine. A lethal dose of fentanyl to a non-opioid user looks like 2 grains of salt in a test tube. So you know, I'm not to say that I'm for this by any means, but it was more, I guess, rational to think that they were putting it into other opioid supply because they were trying to maybe put less supply, make more money, whatever. Like I can actually like think of it logically. But the fact that they're now putting it into any supply across the board, which I've heard of every drug outside of the opiate class being or having fentanyl in it. It, like I said earlier, it has tripled, doubled our cocaine overdose deaths in the past 3 years. It has been seen in I've had clients tell me it's in weed. I've had clients tell me they put it in their Xanax pills. They put it in what you name the drug, and fentanyl's been seen in it. For the longest time, while this was first kicking off, we used to do fentanyl test strips at our office so that people actually had the means to see if fentanyl was in their supply before they actually used their supply. So fentanyl is, like I said, it's not just in opioids, it's in every drug across the class, drug classes. So now New Yorkers who use, even if it's the occasional user and it's not the everyday user, they're just as much as at risk for getting something that may contain fentanyl. I actually think that they're more at risk, and that's due to the fact that when you are not an everyday user, there's a very good chance that when you do pick up, you don't know where your supply is coming from. So your supply could have very well gone through a bunch of hands before it got to you, which means that you're not really sure what's in that supply. Even if it comes in pill form, they're pressing fentanyl into pills. So nothing is safe nowadays if you don't have the means to at least test it before you take it. So unless it actually, I should say, unless it comes from a pharmacy or if it comes something along from the lines of a doctor. But if you are picking up on the street, I would not say anything is out of question when it comes to fentanyl. Fentanyl can't always be detected by sight, taste, or smell. So there is no way that you can actually tell it's in your supply until either you test your supply or it enters your body. And by the time it enters your body, depending on the amount, you can fall out before you even have the chance to tell somebody that, you know, you think that there's something else in your supply. And it's that powerful. Okay, so let's get into Narcan. So Narcan, like I said before, it's an opiate overdose reversal medication. This medication will reverse the effects of opioids. When it comes to anything else, so if someone's having a benzodiazepine overdose, which is your Klonopin, Xanax, or Valiums, if they're having an amphetamine, alcohol, anything that does not fall underneath the opioid drug class, this is not going to do anything for them. The best thing about it is that it absolutely will not do anything to them. So if someone is not overdosing at all, and I've mistakenly taken someone who's fainted on the ground as an overdose, and maybe I've jumped to conclusions, I grab my kit and I spray them in the nose with Narcan, it will do absolutely nothing harmful to them. It'll just give them the inconvenience of having a runny nose because you just sprayed something up it. But when they have an opioid in their system, this is what exactly causes an overdose, is what you're seeing in front of you. So those little pointy upside down trees are called receptors. Our opioid receptors are our pain receptors. So when too many of those receptors get filled with too many opioids, it suppresses our CNS, our central nervous system, and it's almost as if our brain stops telling our lungs to breathe. It gets suppressed so much that our respiratory system will slowly decrease until it stops completely. And that's where that little domino effect at the bottom goes. Your breathing will slow down. It'll stop. Your heart will stop pumping, and then the blood to your brain will stop circulating. The way I like to look at our respiratory system is the ignition to our car. Without the ignition, the car doesn't run. So what Narcan does, which I'm going to go to the next slide. What Narcan does, it's kind of like a bully, and a good bully, let's say. It comes in and it kicks the opioid off its seat and takes its place. So needless to say, the reason why we're able to reverse these overdoses is because you are not just ripping the Band-Aid of them being high off, but you're also putting them into immediate withdrawal, because for that person to be high, the opioid needs to be attached to the receptor. But if you have Narcan in the way, taking its seat, it obviously can't attach. And that's what a reversal is that when someone comes to, is that you reverse their overdose enough and put them further enough into a withdrawal state, or something along the lines of close to being in withdrawal, so that they're able to come to because the opioid has been ripped off the receptor. Next one. So Narcan is safe to use, and it's safe to have in any closet in your house. It does not get anybody high. It's not a controlled substance. If your dog chews it, if your kids get into it, it does not matter. It's not going to hurt them in any way. It has no drug-to-drug interactions or has any reported allergies within reversals. And its sole purpose is to block opioids. So people using drugs are regularly surprised at what's in their everyday supply. Even if the person who is in the overdose state is not like a known opioid user, like I kind of said before, still administer the Narcan. We kind of want to pound that into everybody's heads, just because we have seen people maybe not run to their kits as their first go-to, just because they know that possibly it's a cocaine user, and what, you know, maybe they don't know at that moment is that there could be fentanyl in that cocaine, and fentanyl is an opioid. So Narcan will still reverse the effects of the fentanyl within the cocaine overdose. And if there is enough of fentanyl overdose within that combination, it could still potentially reverse that person. Okay, so I'm going to give you some signs of an overdose. We give you a 5-step booklet when you get your kits. If you want your kits, we'll go over exactly how you can obtain them later. But inside they can see my screen, correct? Okay, all right, just want to make sure. I'm sorry. So inside your kits, you'll get this booklet. Now it's an accordion fold. And on the back, one side's English, the other side's Spanish, but it'll fold out and it'll walk you through the 5 steps. But I'm going to give you some things in order to kind of recognize it before you actually get around to doing any of the steps. So some beginning stages of an overdose may look like, or even in this, the process of overdosing could look like awake but not be able to communicate or talk to somebody. The changing of skin color. So it's usually on the fingertips and lips. On lighter skin people, it's the color blue. On darker skin people, it's more of an ashen color. But if you see their lips and fingertips turn that color, it's usually due to the depression of their respiratory system. Shallow, erratic breathing or not breathing at all, slow, erratic pulse or no pulse at all, sounds of choking and gurgling. So that almost like sleep apnea or not agonal breathing that's usually paired with cardiac arrest. That is kind of what that sounds like. So I've seen a video of somebody who actually got down to 2 breaths per minute before they actually completely stop breathing. So it's almost as if like someone is struggling to get the breath, but actually that's usually their last breath leaving their lungs. And unconscious, obviously, if they're unconscious and unarousable, meaning that you cannot wake them, that's usually a very good sign. And unresponsive to stimuli. So the first step that we tell you to do, which I'm going to pull up right now. Oh, wait. Okay, so these are the 5 steps. So you guys know this is what the booklet will walk you through. The first step is going to be assess the person. Now, you're going to go up to somebody and you're going to shake their shoulders, shout their name if you know them. If not, yell, hey. I can't tell you guys how important it is that you do not baby shake people who are unconscious. Do not do this. Do not do this. Do not slap them. I promise you it's not going to wake them. Don't pour water on them. There's nothing that you could possibly do within those 3 things that's going to even, arouse a response. I promise you it does nothing besides maybe put you in a hostile situation where one of their friends sees you smacking around their friend unconscious. So until I have a training for how to defend yourself in that situation, there's only one thing you should possibly go to. There's one technique, and that's called a sternal rub. I personally like to call it a chest noogie. It's a lot easier for people to remember, but it is the most effective thing that you could do in that. And I usually would do that as soon as I walk up to somebody who I think may be overdosing before doing anything else. And if you watch videos on it, you'll see first responders do it right off the bat too. It is actually one of the best indicators of whether or not someone is in that state. So what you would do is you take your hand in a fist and you take these knuckles right here on your outside of your hand or your fingers. And dead center of everybody's chest, dead center of everybody's chest is a sternum bone right here, your breastplate right here. If you take your knuckles and you put them centered on that bone and grind it as hard as you can, there's no reason to put all your might into it, but hard enough where it would possibly hurt somebody or simulate pain. And then you grind your knuckles into that bone about 8 to 10 times up and down. Do not do it to yourself too hard at home. I've done it by accident. It is extremely painful. It is pain. It's painful. It's stimulating and it's lingering. It stays there for a minute. So if someone is not responsive to that, it is safe to assume that they're overdosing and continue on to the next steps. So the next step is always call 911. We can only give you the tools to revive these people. We cannot give you the tools to keep them alive. Narcan is simply a time extender. It is not a fix-all. So by giving this person the medication, all you're doing is giving the medical professionals that you're about to call enough time to get to them so that the person's still so the person is still without risk of losing their lives. But I mean, it's kind of like I said, it's a time extender. So Narcan lasts anywhere from 30 to 90 minutes. An opioid can last anywhere from 72 hours and on in our system. So if you're comparing 72 to an hour and a half, now when the Narcan comes in and knocks the opioid off, it does nothing to the drug that was actually overdosing them. It just sits in the way of where the drug needs to go to get that person's high. So it's almost as if the opioid is just floating around in limbo, waiting for the Narcan to wear off. And as soon as it does, it will attach right back to the receptor. That person is still at high risk for falling right back into that overdose. It is important that you always make sure that I'm going to go over that in a minute, but it's important that you always educate the person too when they come to, because they're not going to know that they overdosed. But when you are calling dispatches and I like to think that the world's changed a little bit, but I can't tell you that it has completely. Just try to stay away from stigmatized language of drug overdose or something like that. As soon as you call a dispatcher and you say, hi, somebody's not breathing, I'm here, please send help, you are high priority. You will be the next bus that leaves that hospital. Not to say that they would take their time and maybe go on break and then come in and meet you if you said drug or something like that. But there was a study done, and it was done outside of the US of an ambulance arriving 2 minutes later when someone used that terminology. So now we're just across the board try to eliminate it entirely. But they're going to want a lot of information from you. If you happen to hang up on them after telling them where you are, exactly where you are, and then that a person's not breathing, I promise you an ambulance will show up every single time. Okay, so I kind of went over this a little bit, but so it lasts 30 to 90 minutes, and it takes about 2 minutes to I guess we give you 2 doses per kit. It tells you on the back of the kits to wait 3 to 5 minutes for it to activate. What we've seen is that if enough Narcan is administered, the response will happen within the first 2 minutes. If there's no response within that 2-minute window, it's safe to assume that they're going to need that second dose. What we tell you to wait that 2 minutes because we don't want you giving both doses right off the bat. I know that if it is someone dear to your heart, maybe a brother, sister, mother, father, whatever the case may be, a child, you're probably gonna lose your mind a little bit, and you're gonna want to administer everything that you possibly can. But in this case, it actually is more unpleasant for you and for the person you're reversing if you kind of go along your own strategy with administering it. Not that it's hurtful, it's just unpleasant. So if I give somebody 2 doses of Narcan that only needed 1, when they come to, they're going to be in a more severe withdrawal. And that not only is unpleasant for the person you're reversing, it also puts you in a more hostile situation. So, we've never had any physical altercations. No one's ever fought anybody. It's never been like that because if you know anything about opioid withdrawal, you would know that a 5-year-old could push you off when you're withdrawal. People like to call it the flu times 10, but I don't think the flu even stands a chance next to it. It is probably one of the reasons why users continue to use even after they want to stop. The withdrawal is extremely unpleasant, and if you can wait that 2-minute span, it could actually not only be a little bit easier on the person you're reversing, it could also put you in a less hostile situation, and your safety is as important as the people you're reversing. If you have a smartphone, your alarm clock app has a stopwatch. If not, count out loud, yell to somebody else to keep time, but whatever it is, try to space at least 2 minutes in between doses. Let's go to the next one. Okay, so in between those 2 doses, and this is only if you are comfortable enough to do it. If you are CPR certified, you have the option to obviously assess that patient as you would anybody else. If you are not, what we give you is the option. Let me make sure it's just the option. So if you only feel comfortable giving them the Narcan and waiting the 2 minutes and not doing anything else, everything else we give you in your kits are just bettering. It's kind of like icing on the cake. It's just going to better their odds of being reversed. If you don't feel comfortable doing CPR or any type of rescue breathing in the public eye, that is still not a reason not to grab your kit. You can still administer the Narcan, and they still have a very high chance of being reversed. But inside your kits, you'll see a bag that looks like this, and it says Safety Works on it. And I ripped both sides. I apologize. So it says Safety Works on it. It's a white bag. And when it comes out, it's a face breathing mask. It's kind of like rescue breathing for dummies. It is very, very simple. It shows you where to put it on the person's face, like where to line it up. You're going to put it on theirs, never on your own. This is going to be the breathing mask. The only thing I want to touch on and make sure I let you guys know is that there are words. I don't know if you can see because my hand's here. There are words there at the bottom. If you cannot read those words, it says mouth-to-mouth protector. If you cannot read those words and they're backwards, you're holding this the wrong way. And this is made to be a one-way screen. So if you put this on someone's face and you start rescue breathing and you're holding it the wrong way, you're pretty much blowing into your own mouth. You want to make sure you can read the words before you put it on their face and continue on with the next steps. Inside your kits, which if you receive a kit from me and dump it out, because I'm extremely thorough, it'll be as if you open up every piece of paper I put inside there and everything else, it'll be as if I'm whispering in your ears the instructions of what to do. So along that line, I can tell you that right here at this is beaten up, so I apologize, but this is the outline version of everything we usually go over that isn't in booklet form. And nice big here at the top is your rescue breathing instructions. So in case you do feel courageous enough and you feel like you want to, I'll go over the rescue breathing and exactly how to administer it. But again, it took me a while to remember the actual, counts and everything else. So try to use this as the instructions on how to follow it. If you are not CPR certified, please do not, you can if you feel qualified enough, but I would not suggest start doing chest compressions because you could be cracking someone's ribs for absolutely no reason. Sometimes without the certification, you don't realize how to tell for a faint pulse or something along the lines of that, where someone's heart may still actually be breathing and all they need is rescue breaths. Again, I'm not going to tell you how to feel about what you're qualified and not qualified for. And I'm sure if you are qualified, you'll know what to do in these situations. But You want the person lying flat on their back. You want their head tilted almost completely back towards their spine. So this is nice and open. Now, what you're going to do is you're going to put the mask over their face. You're going to pinch their nose and you're going to do 2 regular breaths. That 2 regular breaths is to see if you have a pathway to the lungs. If you do, you'll start to see the lungs rise, and then you would continue 1 breath every 5 seconds. If you do not see the chest start to rise, sometimes the belly rises, sometimes nothing rises at all, and that just means that there is an obstruction in the way. Yes, we do give you a pair of gloves inside your kits, and that is just to be cautious about having the proper PPE, but that does not mean to play doctor, is what I'm trying to say, is because I've seen people stick their fingers trying to loosen an obstruction because they think that they have gloves, and they, you know, if you can't see something and you're not certified to actually be looking for it, do not stick your fingers down anyone's throat or put them in somebody's mouth. You can actually cause a bigger obstruction and actually harm the person more. So if you cannot literally see exactly what may be obstructing it, don't go looking for it. The easiest way to get around that obstruction is to take underneath their head. You're going to go back, side to side, back and forward. That should loosen any obstruction that's in the way that you can't visibly see, and then you would try again. But like I said, if you can't get that pathway to the lungs, it is completely okay, because the Narcan is going to be doing all the work, and the Narcan is what truly reverses these people in these states. So now when they come to, or if you have to leave them for any reason whatsoever, say you've administered the Narcan and the phone's across the room and you now got to call the ambulance, or say they're starting to show some type of response, we always tell you to put them up on their side. Now, since they may be going into a withdrawal, depending on how heavy their use and how much they've been using, and how much Narcan it took to reverse them, they could be in severe withdrawal sometimes. It's not likely, but sometimes it did show, and signs of withdrawal may look like vomiting, diarrhea, nausea. And if you leave them lying flat on their back and they come to and start vomiting, they're at very high risk for drowning in their own vomit. So what we tell you to do, recovery position is up on their left side. It's not necessary, in my opinion, any side is better than their back, but up on their left side, because that's the way the blood's pumped to your heart, as well as your right lung is bigger than your left. So if you were to have gotten anything caught down, you have a little bit more room to play with the open lung on your right side. How to do that is just take behind their right arm, behind their right leg, and just pull it across their body. Don't put their head down. You want their head facing up because you don't want to restrict this airway. But you also, if you can remember, it's not the most important part, but if you can remember, try to lift the arm you're rolling them on above their head so that they're not at risk for going like this and rolling back over while you're away doing what you need to do in order to help that person. Okay. So, monitor and support. So what we tell you to do is that since it wears off in 30 to 90 minutes, when you come to these people and actually when these people come to, you want to tell them that they just overdose. They will have no idea that they just overdosed. To them, they just went into this euphoric type nod off, and now they woke up, they're withdrawing. There may be a crowd of people standing around them that they do not know. And it may be a very emotionally heightened situation. Just tell them, listen, ma'am or sir, like, I just administered Narcan. You were just overdosing. I have EMS on their way. Please remain calm and seated until they get here. You know, what we've seen is that they will stay put until the ambulance arrives, but it's not always 100% that they'll go with them. Unfortunately, even with educating them and letting them know that if they use, they're even at higher risk for overdosing again. If they don't go with EMS, their life is still at risk. I can't tell you how many people thought by going upstairs and sleeping it off that they would be fine, and they just never woke up again. It is just what I can probably tell you the most effective thing to do in this situation is not to chase them around if they decide not to go with EMS, but to educate them on what the risk factors are if they don't go with EMS. When EMS takes them back to the hospital, they put them on a Narcan drip until the opiate is safely out of their system. You know, if they are within the confinements of where you'll be for the next hour or so, or however long, we do tell you to keep an eye on them for 3 to 4 hours, and that's just due to the fact that they can fall back into the overdose. And hopefully you will have another kit or at least another dose to reverse those effects if they do decide not to go with medical personnel, I'm sorry. So I'm going to show you guys, I kind of made this in my office, and I just wanted everyone to get an idea of exactly what the Narcan looks like when it's sprayed off. Now, I know this is, I probably should have put it behind this slide that's after this. So I believe 2 after this, but just so you guys know inside your kits, this is what the Narcan looks like. How I'm holding it there is, this is why I hold it the way that I do. It's the most effective and it tells me 2 things. One, it is, I hold it with my dominant hand, making the P side and putting this one part between my fingers. And this is going to be the thing that releases the medication. It will not be as springy. It will not be like a syringe push. You'll see it in the video. As soon as you feel the pop, everything gets shot out. The other reason why you hold it this way is because this does not need to be jammed to the back of someone's nostril. I know some people think that it's going to be the most effective if you get everything up there, but actually you're going to get it into their sinus passage. And if this goes into their sinus passage, it's going to go down their nose, down their throat. If they're unconscious, they could choke. If they're not, or even if they don't choke, it's going to go into their digestive system and it'll be as if you gave them nothing. The thought behind Narcan is to actually coat the inside of the membrane in the nostril. And you'll see it when it sprays out that it's actually like a mist. It's kind of like when you're online at Great Adventure and you're waiting and it's a hot day, that mist that comes out, that's what it's like. It's not like a super soaker type of shot. It's going to be kind of mystified. So as soon as if you hold it this way and you put this into their nostril, as soon as the bottom of their nostril touches the tops of your fingers, it's as far as you need to go. And that's the best indicator as in where you need to be when placing this in someone's nose, because I'm sure it's not every day you have to place something in someone's nose, and it's probably not nearly as rehearsed as you would think, but that would be the best indicator for how far up or how far in you need to be. So very quickly, I'm just going to show you how to unwrap it. I'm also going to show you exactly what it looks like when it's sprayed off. I don't think there's a way to make this bigger either. I'm sorry. In the back where I'm pointing, you'll see a thing that says peel here, so you know. When it comes out, I'll have a set of instructional guide in there, but I promise you, you're never going to ever have to look at it because it's very simple to use. And that's what it looks like when it comes out. No cap, no nothing. It's good to go. I put it in slow motion for some reason so you could see it.
Mm-hmm.
And that's it. That right there, that one little button push could save someone's life. And that's how easy it is to be a hero nowadays. And the fact that not everybody's jumping at this opportunity can be a little bit mind-blowing to me sometimes. But let me go over just the risk factors. Now, before I go into a little bit of the risk factors, the reason why I hold this whole concept and everything so dear to me is because I grew up, I'm 35. I grew up in a world that, you know, this was not talked about. It was kind of sheltered. And I wasn't a drug user. I was an athlete. I eat, breathe, sleep, ice hockey. I thought I was going to be the first girl in the NHL. And I didn't have any education. Nobody was coming to my school to educate me on it. Nothing along the lines of that, but I also wasn't using, so it wasn't that big of a deal. My senior year of my college career, I dislocated my kneecap and tore my MCL and was handed about 60 Vicodin and about a week later, another 80. And I was told to follow the directions, which said take one every 6 hours. And what I didn't know is that I had, well, I didn't know that I experienced this, but what I didn't know is the connection of what the medication would do to it is that I had went through a lot of traumatic emotional things in my early 20s when I first got into college from, you know, I was sexually taken advantage of by someone I trusted. I also had to come out to a very Catholic, Irish, Italian family. And it was a lot of it heartbreak after heartbreak. And I was walking around emotionally a house of cards. And, you know, when I started taking this medication to help my knee, it not only healed or cured the pain in my knee, it also made all the pain in my heart go away. And my brain made that connection before I even consciously did. And now it was justifying my use. It was telling me why I needed to go out and get more, why I needed to up my dosage, why I needed this, and that. And it went from taking the drugs that the doctor prescribed me to taking about, so that was a 10 milligram Vicodin. I was up to about 25 to 30 milligram Roxasets a day, and I was mixing heroin in with them. I overdosed 3 times. I'm extremely lucky to be here. And to say that I have aspired to be somebody in recovery or somebody who is using, or if I ever saw my life turn out the way that it did, I can never tell you that that was ever a part of my dreams. But Am I disappointed that it happened? No, because I'm so much more rounded of a well-rounded person, and I'm able to interact and understand things. You have a different appreciation for things when you've seen the darkest parts of the world. And it shouldn't take that experience to get you there. But I've buried 15 of my best friends in the past 5 to 6 years. And every time I lose another person, it gets harder. And sometimes I feel like, why keep me over them? They were just as good as people. They could have given you just as good of a training. So that's why I'm so thorough, is because I want to show my higher power that they kept me here. I'm going to do the job they kept me here to do. But this is why this medication is so, you know, it's so necessary, is because it could be somebody who looks like your doctor, like your lawyer, like your child. It could be anybody. This disease does not discriminate. And once you are hooked, I'm going to be a recovering substance user for the rest of my life. Every day I wake up, every night I go to sleep, I consciously make a decision of whether or not I want to be in recovery or if I want to be actively using. I no longer have the luxury of allowing my mind to wander. I don't get to celebrate with any type of substance. I don't get to decompress with any type of substance. I can't allow anything to deter me from consciously knowing that my addiction is in my somewhere in the world, just doing push-ups, waiting for me to kind of get cocky or slow up or not recognize it, and it'll come right back in and it'll hit me harder than it did the first time. So recovery for people is as hard as stopping the use. So just understand that the support system these people need, the constant, you know, therapy. I'm very, very fortunate that I work where I work, and I've been working here for a while now. And it's just not only due to the fact that I love doing what I do, it's also due to the fact that the people I surround myself with are also either fellow recovery people or they're people who love somebody in recovery. So when I'm slipping off and I don't even notice that I am, they'll sit me down and be like, what is going on? What you'll see is that before anyone ever picks up their drug of choice or any drug of choice again, they'll conduct the behaviors that they once did while they were using. So if someone sees those behaviors, and if I'm not surrounding myself with people who are constantly helping me out and looking for those behaviors, I can be conducting them not knowing that I am, and it could be leading me right down the same road that I want to avoid. In that same breath, there are two reasons why we use, and I'm going to go over the risk factors. The two main reasons people use drugs or substances is one, emotional or traumatic suppression, and two is mental illness. So there are two specific reasons. And to me, one is feeling like everybody else, which would be the imbalance of chemicals within your brain. So you self-medicate in order to feel normal. And two is just completely escaping your reality, which was my use, which was an emotional user. So it's important to know that why we take drugs is that the drug is not our problem. It's how we treat our problem. There's something else that needs to be recognized before we can even think about, we can attack the drug all we want, but it's just going to show up in a different form. You got to go to the other things that are feeding that snake rather than just the head, and you have to kill everything around it in order to actually get the whole thing to go down. But 3 of my overdoses are on this list, which is why I always touch on it before. The first one is mixing drugs. Like I said in the first slide, 97% of all of our fatal drug overdoses are more than one substance. And I like to touch on this is that a little bit under 50% of that was alcohol was involved. Yes, it is social. It'll be at business meetings. It'll be at family parties. Whatever it does for you, whatever the case may be, it is as deadly as any other drug out there. Alcohol is one of the 2 drugs that you can actually die from in withdrawal due to violently seizing. So that and benzodiazepines, it's highly suggested that you always detox from those 2 in a medicated environment in case you do start seizing. But any drugs, whether it's two stimulants, 2 depressants, a stimulant, a depressant, it does not matter. If you're mixing 2 drugs that a doctor did not give you the okay to be mixing, you're making yourself more susceptible to an overdose. Changes in tolerance. Now, this especially goes for people coming out of jails, rehabs, and hospitals. Many factors play into tolerance. One of them is on the average person, 3 days of not consistently and daily using their drug of choice, your tolerance will start to reduce. So that has to be daily and consistently built. If I break, say I break my leg and I was doing 10 pills, I break my leg, I go into the hospital for 4 days without my drug of choice, and now I come out on the 5th day, those 10 pills now have the potential to overdose me. And that's just due to the fact that my tolerance is decreased. Other things that play into tolerance is something like the flu. Same example, if I was taking 10 pills, now I came down with the flu, you know, a day or two into the flu of taking that same amount could now honestly overdose me. And I think that there's many other things that play into the tolerance level that we still don't know about and that we'll still learn about, because in my case, I had overexerted myself by playing a hockey tournament 5 games in a row when I haven't picked up a stick, and I was using as much as I was. And the first pill of the third day overdosed me. And that was due to how, I guess, I don't know, I want depleted my body was due to the fact that I was overexerting it. So I'm not entirely sure what else does, but I'm pretty sure there's going to be more. Now, poor physical health obviously is a big one. If you have a previous non-fatal overdose, not to say that this Narcan will ever be something you get immune to, but every reversal does take a shot to your body, and there's only a matter of time before your body gives out, depending on how many overdoses you've had. Obviously the amount of, I guess, the strength of the street drug will overdose you quicker, or whatever the case may be, if you're not used to it. Using alone is the third biggest one that we see, is that, 74% of all of our overdose deaths are happening inside people's houses. They're happening right underneath the same roof of the loved ones who are trying to save their lives. And that's just due to the fact that when you become someone that your parents never aspired you to be, you become shameful, you become depressed, you want to lock yourself away and isolate. And unfortunately, those same people you're trying to save are gonna have their life at risk if you're not constantly checking up on them. So yes, we want to gear everybody up with these kits, but we also hope that everybody will connect us to the people that truly need this and have this problem within their 4 walls of their home, so we can make sure that they have the kits first and foremost. Obviously, the mode of use is always going to be a risk factor of when it comes to overdosing. So whether you're eating something or digesting something, sniffing it, smoking it, shooting it, whatever the case may be, every time you go up the scale, you do it in a more addicting manner, or a mode of delivery is in a more abusive manner, then that is when your increase of overdose will become higher. All right, so inside your sheets, which I'm not gonna go over everything here because you're gonna get it in your kits. Oh my, I'm running on time, right? All right, so hold on. I think there's only like 2 or 3 more slides. So inside your sheets, you'll see this the sheets. You'll see the same 2 exact things that will come in your kits, and it's just the Good Samaritan Law showing you exactly what you would be protected for, and things that you still won't be protected for. First and foremost, if you take a kit, you do not by any means have any legal liability to help somebody who's overdosing. What we give you by you taking this kit is just the option that if you felt courageous enough or felt like you wanted to help that person, you now have the option to do so. That law also protects you against if you crack a rib during CPR, if the person wakes up and tries to sue you for any reason. I've heard some of the craziest reasons. If they try to sue you for any reasons, you cannot be sued underneath that law, saying that you're only trying to help them, not harm them. A lot of the other stuff is more user to user base. So if you use your kit or if your kit expires, we always tell you to call us. You have 6 months until expiration to get a brand new kit. Once you take the training, you are certified for life, unless the applicator changes, which it has in the past 3 years, 4 years. But other than that, you could just take your kit and go. I'm going to offer you a refresher. You have every right to say, no, I don't want it. And you could just take your kit and go. That's completely okay. If you use your kit, especially call me. I will make sure that I drop you a brand new kit off at the front doorsteps of your home, or wherever is most comfortable, as long as you live on Staten Island. And if you don't, I have many other connections in every other borough that will be able to get you that brand new kit that day. And that's just because the people who use their kits are usually the next people to use their kits. I have my number dead center right here. I have this certificate of completion card, which on the back is my home base number. But this number is the number my mother calls me on to ask me where I am on Sundays when I'm supposed to be there for dinner. But it is, you will always get me. If you don't get me, leave a message. I will call you right back. I have been getting a lot of telemarketers lately, and I apologize if I screen your call, but if you leave me a message, I promise I'll call you back. Let's see. Now, these are just kind of myths. I'm going to kind of skip past it because I know we're getting close to time. But there's a bunch of different myths of what you should not do. If someone's overdosing, Narcan is the only thing that is medically, I guess, cleared in order to work. All these other things that people like inducing vomiting, shooting milk into their veins, making them, putting ice on their groin and underneath that's not doing anything. If a person wakes because of those things, it's only because their overdose was non-fatal and they were going to wake up anyway. If someone is in a fatal overdose and you do any of these things to them, you're not going to help them. Narcan is the only thing that reverses those type of overdoses. Okay, so what's in your kits, which I kind of already went over, you're going to have your outline sheet, which I went over. You're going to have this 5-step of what to do when someone's overdosing. You're going to have your certificate of completion, which is your saying that you're certified in Narcan to give Narcan to anyone you think may be overdosing. Your kits will come in this nice little blue pouch. It has a little like climbing hook on it. I like to hook it onto my book bag. It's up to you. You will have a pair of gloves. My suggestion is always to wear your proper PPE, regardless of who you're working on. And you'll have your face breathing mask, and then you're gonna have your 2 doses of Narcan. This is what they look like when they come in the packaging. Other than that, let's see what else we got. Don't worry about that part. Sorry, it really is. It's not as nearly so. I mean, this is just going over certain programs. We put NCAP inside your thing so you can review with them, but it's not necessary if you contact me. NCAP is just a program that will pay your co-payment on a brand new kit if you go to a pharmacy. But I promise you, I go through all those lengths if you would have just contact me, and it hasn't gotten down to that yet. So these are just other programs that our organization offers between recovery and between harm reduction. You know, I'll usually send that with the kits as a list of things that will be inside your I guess your packages, and then that's it. That's my boss and me. So, and then that's Next Step resource, which is our recovery center. And you can contact anybody, even me. You can use that number. You use my my desk number, but that's my cell phone number. So if you want to contact me, if any questions other than something you want to say in a room, by all means, text, call, email, doesn't matter. You could always get in touch with me, and I'll always get back to you. But before I open it up and answer any questions, I just want to truly say thank you so much for anybody who takes an interest or takes a kit today. You could be out there saving someone I love and care about. So thank you a million times over for being kind, for being understanding, and for having an open mind on such a stigmatized issue.
Jamie, first and foremost, I want to thank you so much for sharing your story, a very personal story with all of us here. Yeah.
Thank you. No, of course, that's what I'm here for, right?
It's a very personal and a tough issue, and I really commend you for doing all that you've done for it and being the advocate that you are today. You know, it's hard, so we totally understand, and we want to thank you so much for sharing that. It's not easy to share, you know, and we really want to thank you for that. Second, thank you so much for showing us this very informative and important presentation. It was very educating for me, and there's a lot of things I didn't know here, you know, and then I really got to learn about it and open my eyes about. So I know I'm sure the attendees just feel exactly the same way. So I just want to say thank you about that a lot, and we can open up for discussion if anyone has any questions. I'll see if there's any on the queue.
Thank you so much for saying that. It's very kind of you.
No problem. I don't see any questions, so I'm gonna ask something on my own to kind of get the. Oh, I'm sorry, Jack. Do you want to say something?
Yeah. In your experience with dealing with, you know, people who suffer from opioid abuse, what signs, whether acting, like, you know, like whether personality wise or physical wise, that may be subtle or obvious, can you tell on a person that is actually using opioids?
So like, you're talking about like the behaviors and stuff like that?
Yes.
So so this is what makes the disease so difficult to kind of pin down, is that there's nothing blanketed about this. I can't tell you one thing that every user does that in the beginning would be an indicating sign. The only thing that I could possibly say straight across the board is that you'll see them start to kind of hermit themselves a little bit more. You'll see a lot of the things that they hold dearly to their heart suddenly go missing. And that's due to the fact that we have to sell to get our supply. You know, drugs are expensive. So you'll see those subtle things. You'll see a lying increase tremendously. You'll see it's almost like that notion of someone living a double life. And for me, it was like home, because I was in the closet for so long. So living a double life didn't seem that far of a stretch, and it was a lot easier for me to kind of fool people because I was so rehearsed in it. But you'll see them be a lot more secretive. Like I said before,
behavior, deceptive behavior.
Yeah, it could be deceptive, but like I said, it's hard to say. It depends person to person. So if you were
Right.
suspicious of someone, I would definitely reach out to an office like myself or any other organization that does something along the lines of that and get professional help about it, because, you know, what you could be seeing could definitely be I guess a leadway to it, but also could just be a phase of teenagers, or like, you know, like, so it's very hard to depict. But if you're able to work with somebody who's a little bit more of a professional in that field, it makes it a lot easier to see things clearer.
Okay.
And just to kind of add to this discussion, you know, God forbid, you know, you're in that situation where you want to use a Narcan to help somebody. What kind of advice do you have to tell people how to effectively help that particular person that's going through the overdose? I mean, just obviously they have to be prepared, but is there any other type of advice that you could give them that, you know, just to make sure that they feel confident enough to help and administer this person?
So now I know that in every group of people there is a fight, flight, or freeze.
Mm-hmm.
And I've had a client, I'm sure I've had more than one, but I had one specific client that took my training and was a freeze. And somebody in the middle of ShopRite dropped, just dead in the middle of an aisle, dropped into an overdose. And she froze, completely froze. She had Narcan on her, but completely froze solid, couldn't move, was just staring at the person. Luckily, about 2 aisles down, someone heard her heard someone yelling, and they came over and they were off-duty EMT.
Mm-hmm.
And they said to the woman, you know, does anybody have any Narcan on them? And she snapped out of it, was like, I have some in my car. She ran to her car, gave her kit to the person who was the fight in that situation. He was able to reverse that person, and they all were able to save it. So unless you're in a situation where it's within your own four walls, there's not going to be many situations that you're in it alone. So I would definitely say, you know, lean on the people that are around you, especially if you're a more of a shyer, maybe not as confident type. But there really is no way to kind of mess this up. It's a nasal spray. So if you think someone's overdosing, it's very simple. You assess them. So just go up to them, do a sternal rub. No response, call 911, give them the Narcan. And then if you feel comfortable enough, do rescue breathing. The best thing about this is that even if they aren't overdosing, if you give them the Narcan, all you have to do is get a brand new kit, because you did nothing harmful to them. You did nothing bad to them. So it's better to be safe than sorry. I would say breathe through it. Just know that overdose reversals are a little bit like more of an extended time and not as instantaneous as heart attacks or seizures. It's not like, yes, it is happening right then and there, but you have that extra, and let me be specific, second, not like an hour, but you have that extra second to breathe and actually get you compose yourself in order to do the job that you need to do, rather than somebody who may be seizing, where you have to be active and right on the ball and right there, right then and there. So it gives you a little bit more of a comfort stand when it comes to actually having to step up. And like I said, although as much as I hope that everyone will, there's nothing legally holding you to have to. But if you see someone else around the situation that is capable, just let them know you have your kit, and any life can still be saved in that instance.
Yeah, unfortunately, you're not going to know until, like, it's really a question of character and will. You know,
I know.
and you're not going to know what you're going to do until it happens. But
I know, it's so sad. I know that, and you know, that doesn't make you a bad person not to know that, but you won't know you're a fight, flight, or freeze until that actually puts you in a situation where your life's at risk either. So, you know, you find out real quick. If you want to actually find out, the easiest way is go through a haunted house alone.
I've done it.
So
nothing happened. I wasn't scared at all.
That's good then. Then you should be around every situation.
That's what my fiance says. He was an EMT. He's a firefighter. So he's like, you would have been great for the job.
There you go. Yeah, you definitely would have. That's amazing. But yeah, so I mean, as long as you're in a group, you'll always have one of the three around, even if you happen to be the one that's maybe not as aggressive in that situation. And anything you could possibly do to help somebody see another day, that's more than anybody could have ever asked for. So don't feel like this is all relying on or laying on your shoulders, that, you know, their life is dependent upon you, and whether or not you do this right, it isn't. And any effort you put into it is more than we could have ever asked for. And we're as appreciative as if you were to do it correctly, straight through and through. I could tell you I messed up the first time I did it, and I'm a Narcan trainer. I'm literally the head of Narcan. And it is an extremely emotional situation. And it's not that I messed up with administering it. I messed up with the terminology and what I should have said in front of the client, because she took off on me in her car. And I know I was driving around Forest Avenue. I came across a car and a woman who was oddly passed out, like through Overwoods, and she had the headlamp on. I was like, that's odd. So I went back around and I drove by a car and I saw the little orange caps that normally come on syringes. And I went to her car and was banging on the window. And I don't know if God was with me that day or not, but first, more newer makes of the models, when you stop the car, they lock the doors. Her door happened to have been open. I was able to give her at least one dose. And then when I was on the phone with the ambulance, which I probably should have hung up, I had said, you know, when I got off, I was trying to talk to her and talk to them. And I was like, listen, the cops are on their way. Don't worry about it. It's going to be okay. And, you know, I should have said ambulance or help. I should have said anybody besides cops. And the second I walked, I couldn't hear because she was yelling. The second I walked far enough away from the car, she slammed the door and took off on me.
I mean, you did your duty, you know, you tried to help, you tried to get the situation in a better place. I mean, that's all you can do.
That's what I'm trying to tell everybody else, is that there isn't, when it comes to real life situations, the textbook is not how it looks. It's never going to be that pretty textbook. This is, you do this step and then it pans out perfectly and you do that step. So, I mean, any effort is more than we could have asked for. I mean, if you don't do it right, if you don't get the chance to do it at all, that's okay. I mean, hopefully next time.
And just before we close out, I had one more question about Narcan, because and correct me if I'm wrong. It's not applicable to all drugs. Is that correct? Was I understanding that correctly? Okay. So if you're in a situation where the Narcan doesn't work for a particular overdose situation, what would be the next step for that?
I mean, it's so, I don't want to make anybody, I do like educating, but to the sense where I don't want anyone to become a doctor on their own. And it's just because I'm guilty of it myself. So I try not to pose it on other people. But things you can look for within an overdose, which you're always going to give Narcan. Don't ever just depend this on whether or not you give the Narcan. You always give the Narcan. And before you even give the Narcan, an ambulance is on their way. Right. So the professionals anywhere, I mean, this is pre-pandemic I'm going off of, but given the time of day and the day of year, as soon as you say someone's not breathing, an ambulance will be there from 6 to 8 minutes. So you're not going to be with these people very long before help arrives. Right. But to look for what kind of overdose you may be dealing with, which I said, don't take this and run it with it, because there could be an opiate still mixed in it. Right. Depressant overdoses turns the body blue, turns the lips and the fingertips blue. A stimulant overdose would be the over rushing and beating of their heart. That would make them more of a flush color. Opioids is a depressant. So, but like I said, it just because they're red and they're not blue does not mean not use their Narcan. It just means that there's probably an overwhelming amount of a stimulant in there, along with possibly an opioid, but still use it and still hope for the best. And it's better to be safe than sorry.
Thank you so much, Jamie. Thank you. I
really, you guys.
Thank you. This was so informative, really, and it definitely touches on the unspoken but huge topic of the opioid crisis here on Staten Island.
So if anybody does want to receive a kit, I don't know. Let me see something really. Oh, let me get it. Let me stop screen sharing. Sorry.
No worries. We have your information, so I'm definitely going to reach out to you just to follow up on a few things. So if there's anything that you wanted to share with the SIEDC team or any of our member sponsors, we'll gladly be able to forward that information over.
Perfect. Yeah, because I normally have people email me their addresses so I could send out kits. So that's perfect. That's perfect. So we'll coordinate.
Thank you.
We'll definitely be like recapping this information like on our network and through our email blasts. And I'm sure that you're going to get a lot more requests to get Narcan packets as well.
Okay, no problem at all.
Thank you.
Thank you guys so much. I really appreciate it. It's been a pleasure meeting you both.
Likewise. Thank you again. Thank you.
Take care, guys.
All right, take care.